Today, we are covering droplet precautions, a topic the NCLEX loves to test through prioritization and select all that apply questions. The exam expects you to act, not just know. Imagine you're admitting a child with a high fever, cough, and a suspected diagnosis of pertussis. The question will ask for your immediate nursing action. The answer isn't to administer medication or call the doctor. It's to initiate droplet precautions. This means placing a surgical mask on yourself and on the patient if they need to leave their room. A common exam trap is confusing droplet with airborne precautions. The key difference is the size of the particles. Droplets are larger, traveling only about 3 to 6 feet before falling. Airborne particles are smaller and can remain suspended in the air for long periods. This is why droplet precautions require a standard surgical mask, not an N95 respirator. If you see an option for an N95 for a patient with influenza or bacterial meningitis, it's almost always a distractor, unless an aerosol-generating procedure like an intubation is being performed. The NCLEX will test your knowledge of which diseases require these measures. The most effective way to remember them is the mnemonic SPIDERMAN. S stands for sepsis, scarlet fever, and streptococcal pharyngitis. P is for parvovirus, pneumonia, and pertussis. I is influenza. Is diphtheria. E is epiglottitis. R is for rubella. M is for mumps, meningitis, and mycoplasma. And AN is for adenovirus. If a question mentions any of these, your brain should immediately shift to droplet precautions. Let's consider another exam-style scenario focusing on resource management. You have 4 patients needing admission and only 1 private room is available. The patients are diagnosed with C. diff, tuberculosis, influenza, and shingles. The patient with tuberculosis gets the private negative pressure room because it requires airborne precautions. The patient with influenza, requiring droplet precautions, can be placed in a room with another patient who also has influenza. This is called cohorting, and it's a valid option the NCLEX expects you to know. A private room is preferred, but cohorting with a patient infected with the same organism is acceptable. When it comes to patient transport, it should be limited, but if necessary, the patient must wear a surgical mask to contain respiratory secretions. You, as the healthcare provider, must also wear a surgical mask whenever you are within 3 to 6 feet of the patient. Remember the core components for the exam. A private room is preferred, but cohorting is an option. Personal protective equipment, or PPE, is primarily a surgical mask. And for patient transport, the patient needs to wear a surgical mask. Master these points and the SPIDERMAN mnemonic, and you'll be prepared to correctly answer any droplet precautions question the NCLEX throws your way.